healthcare I've received since moving to the United States. Now again, I don't have any teleprompter, so please bear with me. My husband and I were born and raised in Ireland, and about 15 years ago we actually came here to the United States, legally, I might add. It can be done. And we became American citizens a little over a year and a half ago. We're very proud. Now, the current administration is trying to convince us that this healthcare reform is not going to cost us anything, that our taxes will not go up. Who are they trying to fool? Are you buying it? I'm going to give you an example. In Ireland, some of the taxes that people pay, they have a 25% VAT tax. They have, when you buy a house, you'll pay 7% sales tax. When you put gas in your car, you have nearly a 50% sales tax. They even have a 4% health tax. The list goes on, but I don't want to bore you with all those tax details. There is a reason overall taxation in Europe is higher. Somebody has to pay for all that government health care, all those entitlements, and it's not just the top 5% of earners. It will affect everybody. Everybody. You know, there's a huge healthcare debate raging in this country at the moment, but they don't want to seem to include our voices. Is Washington listening to us? No! So that's why we're here today, to have our voices heard and our message understood. For me, personally, nationalized healthcare could be summed up in 2 words: waiting list. Now, you'd hear many in the current administration speaking in glowing terms of the healthcare in Canada and in the United Kingdom. I don't see them going there for treatment, though. They're politicians. They wouldn't say anything else. And then you hear the horror stories of people living in this country where they have been denied critical care, delays in life-saving drugs. And what you don't hear are the day-to-day stories of people living there who need to see a doctor, they may need some tests done, they may need to see a specialist. And what it really means. I know somebody who believes that if this healthcare reform passes, she won't have any copay. She can go to the doctor and be free. Will it? I don't know. Nobody knows. That's the whole problem. But let's talk about that free doctor's visit. Because when I lived in the United Kingdom, you could go to the doctor for free. But there's always a catch. Here's how it worked. You turned up at a doctor's office, you signed in, and you waited your turn. You couldn't make an appointment, you couldn't specify your doctor, and you were lucky if you got out in about 3 hours. I'd like going to a social security office or something else. But that's government run too, right? So, about 85% of the jobs created in this country, they're small business. How many of you here work for a small business or own a small business? That's a lot of people. That means there's a lot of people who are self-employed, who are contractors, who are on an hourly wage. If you have to take 3 to 4 hours out of your workday to see a doctor, how much is that free visit really costing you? Now at the moment, I can make an appointment to see my doctor, and on average, I get out in about 30 to 45 minutes. And I like that system. Do you? Yes! We want to keep that system. But it gets even better under a government-run plan. The following are a few examples of identical situations where my family here in the United States, we needed healthcare, and my relatives in Europe also needed healthcare. We'll do some side-by-side comparisons, and you tell me what you think. My husband recently needed to see a back specialist. It took him 2 days to get that appointment. My brother in Europe, it took him 13 months to have that appointment scheduled. Now, if you're living in chronic back pain to the point that you can no longer work, what consolation is it to have a cheaper or even a free appointment if you've lost your job and you're no longer able to live in any kind of comfort because of the chronic pain? Is that any consolation to you? No. Then I can give you another couple examples of trying to see specialists. One of my children needed to see a cardiologist. From start to finish, seeing the specialist, having a test on 4 days. My nephew in Ireland, It took nearly 4 months. Now, you were a parent with a small child. Don't you want them taken care of? Imagine being told that you have months to wait for that appointment. And remember, these aren't even life-threatening situations. These are just day-to-day testing that is done all the time. Another child of mine needed to see an internist and have some testing done. It took about 5 weeks in total. My sister in Europe, the same process. It took nearly half a year. And she was lucky because she got a cancelled appointment and it moved her time. Otherwise she'd have been probably waiting nearly 8 months. Are we seeing a pattern here?
Yes.
Does this look like a good idea?
No.
Okay. Then there's the inevitable waiting list because if you have too few doctors, too few medical facilities, and too many patients, what is going to happen? What is the reality? No care, rationing, delays. This is not the America we came over to 15 years ago. I have said to my family there's only one country in the world where I would want to be if I was sick, and that is the United States. You know, you see a lot of seniors, older people at these town halls concerned that their health care will be delayed, will be denied. And I believe they have every reason to be concerned. I'll give you a couple of examples. I know of 2 people in Europe who need hip replacement surgery. A fairly common procedure as you get older. Now in the first case, and this was nearly 8-10 years ago, they were told they'd wait nearly 2 years for that surgery. Now I have my sister-in-law who also needed to see the specialist. Just for her appointment, it was nearly 2 years. But she was lucky. She knew somebody who could work a bit of magic, and she got that appointment in a few weeks. Do you know somebody who knows somebody who could work that magic for you? No, neither do I. Now, if you also need to stay in a hospital, and this is where it gets really good, you might share a room with a dozen or more patients, and the telephone is down the hall along with the public restrooms. Does that sound enticing if you're sick in a hospital?
No.
You know, there was times when my mother was in hospital and I wanted to speak with her. I'm 5,000 miles away from her, and if nobody picked up that phone in the hall, I could not speak with her. I'm not saying it'll happen here in the United States. I'm just saying. Now, I know there will be people who will say, that couldn't possibly happen here. Well, really, because we already have a form of government-run healthcare and our veterans use it. Raise your hand if you're a veteran or you know somebody who's a veteran. Thank you for your service to this great country. Now, the VA many times has been characterized by long lines, aging facilities, and better yet, poor funding. I recently read an article where nearly 10,000 of our veterans have been exposed to the AIDS or hepatitis virus, where nearly 100 of them had botched radiation treatments. If our country, our government cannot take care of our veterans who have put their lives on the line for the safety and security of the freedoms of this country, how do you think they're going to take care of the rest of us? Do you think they're going to do that? No. So, you know, we're going to have to work hard to keep the healthcare system we already have. We're going to have to keep the pressure up. Make those phone calls, send those emails, make appointments to see your senators and congressmen, if they're brave enough to schedule any town halls, that is. Please remember, our elected officials work for us, and they will pay the ultimate price of being voted out of that precious office. Not as I do, and that needs to change. So let me ask you, are you part of an angry mob?
Yes.
Are you evil mongers?
No.
Are you un-American?
No.
No, and no again. We are patriotic Americans exercising our right to free speech. We the people of the United States, we will stand united and we will make that difference.